Also, let's not forget the New Finder newspaper, now under the Zed Multimedia umbrella, delivering insightful journalism with a business focus. Join us on the journey where innovation meets inspiration, where lifestyle meets leisure, and where business thrives. Change is here. Zed Multimedia, your lifestyle, leisure, and business platform.
It's your lifestyle, leisure, and business radio.
Hello, good afternoon, and welcome to the Zed Wellness Link. My name is Dr. Paddy Aite, and I'm your host. We apologize for the late start. It was due to, as they used to tell us, circumstances beyond our control. So we do apologize. Today we are talking about digestive disorders, especially ulcers, acid reflux, gastritis, and all their cousins and relatives. And with us in the studio is a lovely lady. Her name is Dr. Fatima Mohammed. Yeah. She is a gastroenterology fellow, which is a very big title at the Kolebu Teaching Hospital. Yes. Yeah. And she's our expert for today. Dr. Fatima, you're welcome. Should I call you Dr. Fatima or Dr. Mohammed?
Dr. Mohammed.
Dr. Mohammed. My father doesn't like it when people call me by my first name like that at all. So Dr. Mohammed is the right designation, and that we shall use. Ulcers, acid reflux, gastritis. Those are like what we commonly know as the typical digestive disorders. Mm-hmm. And are they, from my perspective, people tend to complain about those things quite a lot. Are they quite common?
Yes. So ulcers, gastritis, reflux, and other digestive disorders are really more common than we think they are. For most people, I'd say that the symptom of, what we call dyspepsia. So that's any uncomfortable, feeling of bloating, pain in the region of the stomach, nausea, vomiting, anything to do with, digestion. is a common complaint, but not all causes of dyspepsia is related to an ulcer.
Okay.
So you find people, throwing the term about.
They say their ulcer has come.
I'll say loosely, yes.
I wonder what that means. And first of all, do you own an ulcer? Does it have your name, your name written on it?
Something you should own. I mean, ulcer is not like hypertension or diabetes that you say that, okay, I have ulcer and you should have it for life.
Mm-hmm.
No. It's something that is treatable. It's something that I'd say is short-lived if you take the right medications, and you don't necessarily have to get it again.
Good.
Yes.
So let's try and distinguish between these three big people. We shall talk about their other relatives.
Okay.
What is an ulcer?
Yes.
A peptic ulcer.
Yes. So a peptic ulcer is, I'd say, for the purposes of the general, public, it's like a wound or a sore in the region of the stomach or a part of the small intestine called the duodenum. Yes. So.
Okay. So that is, if the ulcer is in the duodenum, it's called a
duodenal ulcer.
A duodenal ulcer. And if it's in the stomach,
it's a gastric ulcer.
A gastric ulcer.
And together they make up peptic
ulcers.
disease.
Okay.
Yes.
So the ulcer is a sore.
Yes.
Well, if it's on your leg too, it's a sore. So
exactly.
It's just a sore in the tummy. What is acid reflux?
Yes. So before we understand what acid reflux is, we need to understand that when we eat, the food goes through our mouth into a pipe that connects the mouth to the stomach called the esophagus. And then from the esophagus, it then enters into the stomach. Now, between this esophagus and the stomach, we have what we call a natural or physiological, valve mechanism, where when the food goes one way, we don't expect it to come back the other way.
It should be like a non-return valve.
Yes. So once the food goes, the muscles maintain a certain level of tone that keeps that valve closed, But in some people, physiologically or normally, when we are not feeding or in between feeds, we have what we call transient relaxation. So that valve relaxes once a while. But in people who get reflux, you find that this relaxation happens more often than usual, even at the time of feeding or just after feeding, not necessarily in between feeds. So when this valve relaxes, then that one-way valve mechanism is disrupted, and then the acid and sometimes the food comes back up this pipe called the esophagus. And because normally that's not where the acid is supposed to be, it causes burning and irritation. And in very severe cases, it can also cause ulcerations or ulcers in that esophagus. Yes, the stomach is designed to contain acid. It has a lot of mechanisms. It has mucus, a slimy substance that protects the lining from the acid causing burns in the stomach. But anytime this acid finds its way outside its natural environment, which is the stomach, into that food pipe, then we have problems. Yes. So
okay, so that is acid reflux.
Yes.
Okay, I'll come back to why the valve doesn't open. But for our definition, we are trying to find, and when they say somebody has got gastritis, what does that mean?
So gastritis is like a general swelling, or I don't want to use the term inflammation because not everybody really understands. But for those who understand, it's like inflammation. So assuming you have you've hit your head against something, it didn't become a sore, but then you notice swelling, redness, and pain around that area. It's a similar thing that happens in the stomach. And so when there's irritation and swelling and pain generalized in the stomach wall, then we call that gastritis. It's not necessarily a sore, but it's also a process that can cause, a significant level of pain for the patient.
Okay. So now we understand what a peptic ulcer is, we understand what acid reflux is, and we understand what gastritis is. 2, 3, but they all cause tummy pain.
Yeah.
So we can't assume that once your tummy hurts, it is this or that or the other.
Exactly. So it's difficult to, just say with the symptoms that you experience that this is ulcer or reflux or gastritis. You need further evaluation to be able to determine that. However, gastritis is ulcer has a characteristic pain, especially if it's stomach ulcer. I told you peptic ulcer, we can have it in the stomach or a part of the small intestine called the duodenum. So if it's in the stomach, it has some characteristic features that we can use to differentiate it from that in the duodenum. Yes, so in the stomach, because that is where the food enters first, you find that the pain is worse immediately you eat or even during feeding. So as soon as the food falls into the stomach, you get the pain. This is also common with gastritis because it's a similar mechanism. So if there's inflammation or swelling in the stomach and the food hits the walls, you'd have the pain. However, for duodenal ulcers, it is when you are not feeding, like in between feeds. So you find that in the middle of the night, because you would have fasted for a while, whilst asleep, then it wakes you up from sleep.
Okay.
That's severe pain, yes.
So there's a clear distinction between one type of pain and the other type of pain. Why? What's if you feel should make you realize that you need to seek attention?
Yes. So for the general word dyspepsia that I use, so if you have bloating, nausea, any sort of pain, of stomach origin or around the region of the stomach, we advocate that you seek treatment. But for these categories of patients or these symptoms that I'm going to mention, is an absolute, you must seek care. You don't have to delay. So we call them the alarm symptoms. So if you have persistent, loss of appetite, you cannot keep anything. You don't feel full.
You don't feel like eating.
Yes, and it's prolonged. You have to seek medical.
Prolonged means what? 2 days?
So like a week.
A week.
Yes.
So lack of appetite for about a week.
Yes, you need to seek.
And you are not fasting.
And you are not fasting, and it's not intentional.
Okay.
You have to seek treatment. And if you've lost weight, yes. So if you've lost weight, so we say that any unintentional weight loss, you are not on a diet, and you've lost about 5 kg in a week or up to 10 kg in a month, then you need to seek treatment right away, because it might not just be ulcer, it might be something more serious.
More serious.
Yes. If you also have symptoms of blood loss like anemia, so the symptoms would include dizziness, you feel your heart beating a little bit more, faster than usual,
Yes.
Lightheadedness, you get tired easily, you get breathless when you walk, then you have to seek treatment. And then also if you have blood in your stool, so sometimes it's bright red blood and you can tell that,
this is blood.
Yes, this is blood. I know, a lot of us don't like looking at our stool when we go, but it's necessary, especially if you have symptoms of dyspepsia, to observe your stool color.
So you just look in the bowl.
Yes, so it might just be blood.
What are you looking for when you look in the bowl?
So you are looking for streaks of blood on the stool.
Okay. Sometimes
because the blood may have stayed in the stomach for a while, it changes color, due to the acid, breakdown of the blood products, and it may become very black, what we call melena stools. So if your stool is looking very black, like coal tar, that's a dangerous sign. You need to seek treatment as well. If you also have persistent vomiting, so not just a day or two, so more than 3 days, and you can't keep anything down, it is a red flag. You need to seek treatment. If you also have persistent nausea, it's also a red flag. So you need to seek treatment.
So anybody who has, any of these things, it's really important that they seek treatment.
Exactly.
Okay, excellent. What causes this?
So for the ulcer, gastritis and ulcer are related in their causes. So for peptic ulcer, the main agent that is responsible is an infectious agent called Helicobacter pylori. I know it sounds like a big name, but it's just a bacteria that causes by different pathways or mechanisms. It causes erosion of the gastric mucosa or the gastric lining, and then leads to this sore that I'm talking about that can cause all these signs and symptoms.
Okay.
Apart from Helicobacter pylori, which I must say is something that is infectious, so if there's a household contact or somebody in your household who has it, it can be transferred to
How
you.
is it transferred?
Yes, so we say it's a fecal-oral transmission. So from the person's fecal matter to your own, mouth. I know you may think this is absurd, this is something that can never happen, but imagine somebody has it, goes to the washroom, does not clean their hands properly, and makes a meal for the family. The whole family can get Helicobacter pylori infection. And that can lead to an ulcer, yes. And if you buy from a vendor who doesn't observe very good hand hygiene practices, that can also lead to transmission of Helicobacter pylori infection. So apart from the bacterial infection, we also have alcohol. It's one of the notable causes of peptic ulcer disease. And also painkillers. So of the painkillers, we have a certain group that is called non-steroidal anti-inflammatory drugs.
Okay.
For example, our diclo, our brufings and all that, in that category, they can cause peptic ulcers. Yes, and it can actually cause significant bleeding that can lead to an emergency. Yes, and apart from these main causes, we have other factors that we don't say they cause it per se, but they can
contribute to it.
Contribute or even increase,
your chances of getting.
Or even increase your symptoms. We call it exacerbate, worsen your symptoms, as I must say. So stress.
Ooh, stress.
Yes.
Stress is here too.
Yes, so stress can exacerbate or increase or worsen symptoms of peptic ulcer disease. Because when you are stressed, there are lots of hormones that are produced. We call them the stress hormones, and cortisol is amongst them, and that can contribute to a peptic ulcer disease. And also, I forgot to mention those on what we call some medications steroids. Okay, so these medications just act like when you are stressed. So when you are stressed, it's a natural phenomenon to release the cortisol, but some people take them as medications for other purposes. So these steroids can also lead to peptic ulcers as well.
So those who are taking steroids for cosmetic reasons,
yes,
they want their bodies to look some way.
Absolutely.
Those who have the stretch marks on their bodies,
On their skins, yes.
they are the ones, they are also at risk of having peptic ulcer.
At risk, and for them, their risk of bleeding is even higher, so they can bleed from these ulcers as well.
Wow, you are trying to solve one problem and you end up creating
Exactly.
a different one. Ladies and gentlemen, we'd like to take our first break. Our first song will be a song by Dinah Hamilton. Title is The Name of Jesus.
Zed 101.9 FM.
Hey, there is an
Dr. Mohammed, you mentioned stress as a major cause of these problems.
Yeah.
You also mentioned alcohol. How much does alcohol consumption contribute to these problems?
Okay, so in general, as gastroenterologists, the recommended amount for both male and female is 14 units a week.
What does that mean?
So let's say if you are taking pure alcohol, you shouldn't be taking...
Which one is the pure alcohol?
That's the akpeteshi.
Akpeteshi.
Yes.
Say VC10, akpeteshi.
So yes, a tot of it is
one
like
tot
1 unit.
1 tot is 1 unit?
Yes.
So you're allowed 14 tots a week?
Technically.
Okay.
Yes.
I just want to know the volume that is permitted.
Technically.
Somebody wants to know.
It used to be 14 for males and 21 for females.
Women were allowed to drink more?
14 for males and 21 for females.
14 what?
It used to be 14 units for males. So males were not allowed to drink as much as females.
That
but
is
now
what
it's
is...
been, uniformed.
Oh,
because now
equality has come inside.
Yes, equality has come in. We've noticed that a lot more women were getting, liver cancers and all that. So, it's 14 units across.
So 14 units.
Yes.
That is not more. That is not more than 2 tots a day.
Yes, or an average beer bottle a day.
So not more than 1 beer bottle. So a beer bottle is what? 2 units.
2 units, yes.
Okay. And in whiskey?
A whiskey a tot is 1 unit. It depends on the strength.
So whiskey and akpeteshi.
Yes, it's about 1 or 1.5.
Okay.
Yeah.
Wine.
Wine, a glass of wine.
A glass of wine.
It's about...
The beer, is it the big bottle or the small one?
It's the big bottle.
It's the big bottle. So you're not allowed more than 1 a day. And not more than 7 a week. So if somebody gets up and decides that the whole week he won't drink, but on Saturday he'll drink 7.
Yes. So the binge drinking has a direct link to gastritis and peptic ulcers.
Oh.
Yes. So it can cause, sudden, especially if you have pre-existing peptic ulcer and you binge drink, it can lead to bleeding, for instance. Yes. So it's not advisable to do that.
There are some people who, even though they have the ulcer, they still drink.
Yes. So we advise that, apart from the drinking, you stay away from the medications I mentioned.
Mm-hmm.
So the diclo, the brufings, the steroids. Once you have a history of peptic ulcer, you should stay away from these things. Yes.
Smoking, yes. Smoking makes it worse.
Smoking is actually a contributory factor to the development of peptic ulcer. Yes.
So they can't smoke, they can't drink, they can't take certain kinds of painkillers.
Yes.
Hey, it's better you don't even get the ulcer at all in the first.
Yes, it's better you don't get it.
You don't get the ulcer at all in the first place. So assuming that you've been diagnosed with any of these conditions, acid reflux, peptic ulcer, what lifestyle changes would you normally recommend for them?
Yes. So for the peptic ulcer, I just mentioned a few.
Mm-hmm.
For reflux, apart from the fact that people have, who have reflux have more relaxations of their the valve I mentioned. Mm-hmm. For people who are obese, they have more a higher risk of getting reflux than the general population.
Okay.
Yes, and most of them have what we call hiatal hernia. So hiatal hernia just means that where the valve is, or a part of the stomach actually goes beyond the diaphragm. So the diaphragm is a muscle that separates the lungs in the chest from the organs in the abdomen.
Mm-hmm.
So the esophagus, the tube I mentioned that when we feed through connects the mouth to the stomach,
yes,
has to go through this diaphragm before it enters into the stomach. So for people who are obese, some of them have
a gap in the diaphragm.
A gap in the diaphragm that allows a part of the stomach to push through.
Mm-hmm.
So that actually weakens this valve mechanism because the diaphragm contributes to the valve mechanism. So if you have that, you are, at a higher risk of getting acid reflux. So we advise weight loss for those people, and also for reflux, mainly apart from the medications we give, lifestyle plays a very key role. So we ask that you don't binge eat, not just binge drinking on alcohol as for peptic ulcer. So you don't binge eat. You don't go to a party and then you want to eat everything, on the tray. Because when you do that, you distend the stomach more and you are at a higher risk of, having reflux symptoms. And also you have to eat at least 4 hours before you go to bed. Because when you lie down flat, the mechanism that moves the food back into the esophagus is worse than when you sit up. When you sit up, gravity helps to push the food or keep the food down. Because they have a defective valve mechanism, when they lie down, the food and the acid has a higher risk of going back into the esophagus and causing more symptoms. So we advise that if you are going to eat, it should be at least 4 hours before bedtime. And for those who still have very severe symptoms, despite all these measures, we advise that you raise the head end of your bed. If you have a bed that is adjustable, that's perfect. Otherwise, you can just put like a solid substance, like a brick.
A cement block.
Yes, a cement block at where your head end is, so that you can lift up.
You put the block under your pillow.
Under the bed.
Under the bed.
Yes.
Okay. Under the legs of the bed.
The head side of the bed.
Okay.
We find some people using pillows. What happens is that when you sleep, you cannot determine the position of the pillow any longer. So you wake up and the pillows are somewhere else.
You are somewhere
so
else.
So you need a more, a semi-permanent, structure that can keep the esophagus above the level of the stomach and then reduce the symptoms of the reflux. Yes.
Lose weight, avoid alcohol, avoid smoking. Don't eat 4 hours before you go to bed. So don't eat and go and lie down immediately. What about spicy foods?
So spicy foods is a bit controversial because for some people, we also advise that you keep a food diary. So for some people, they notice that certain spices worsen their symptoms, especially tomato-based foods, pepper, and oily foods in general. Keep the valve lax, so we advise that you cut down on them, but it's dependent on the individual. So if you notice certain foods worsen your reflux, you have to stay away from them. Carbonated drinks, as a rule of thumb, worsens reflux because the carbon dioxide that is added to the drinks, have a pressure effect on the valve, and then it can also keep the valve more open longer than it should and worsen the symptoms of reflux. So we advise that you stay away from carbonated drinks and eat in bits. So if you have to take your lunch, we advise that you divide it into two. Eat a portion and then eat the other portion maybe an hour or two later.
So you should eat in small doses.
In small doses. And don't, drink a liter of water as soon as you eat. By the same mechanism, if you binge eat or you drink so much as soon as you eat, it keeps the stomach, more distended, and then it worsens, the esophageal valve mechanism, and then it causes more reflux.
What kind of medications are typically used to treat this condition?
So for reflux, we would give you what we call a proton pump inhibitor, PPI for short. So the common ones on the market is omeprazole, but we have others. We have esomeprazole, rabiprazole, pantoprazole. So it's a group of medications that reduce the level of acid the stomach produces. And so when the acid levels are reduced, the risk of reflux symptoms would be lower.
So it reduces the amount of acid you produce,
Yes.
and the effect, therefore, is that even if you have the reflux, the effect is less.
Yes.
Is that right?
Yes. Because
Okay.
it's the acid that actually mediates all the negative effects. It causes irritation of the lining of the esophagus, and over time, if you are not careful, and this irritation keeps going on and on over years, it can develop into more serious things like esophageal cancer. So the PPIs actually help to reduce this risk tremendously.
So when you take those drugs, how quickly do you get relief?
Yeah, so for PPIs, about 24 hours, you should get some relief, but it takes
So
a
they
while.
don't work immediately.
Yes.
Okay.
I mean, if you already have the esophagitis or the erosion of your esophageal lining, it would take about 4 weeks for complete healing to take place.
Okay.
Yes, but your symptoms should reduce within 24 hours. Yes.
I like to tell my clients that you take the PPI today for relief tomorrow.
Yes.
So don't wait till the pain comes before you start taking it,
Yes,
because
so
it doesn't
people
work.
expect like a magic, it's not a magic drug, especially if you already have, very serious esophageal irritation or esophagitis. It will take about 4 to 8 weeks. So we put our patients on the drug for about 4 to 8 weeks, and then we reevaluate. If after this time they are still having severe symptoms, then we want to do what we call an endoscopy to look into the esophagus to see if there's something more serious that is going on.
How is the endoscopy done?
Yes, so an endoscopy is a flexible tube that is put through your mouth into the pipe I mentioned, the esophagus, and down into your stomach, and also to the second part of the duodenum. And usually what it does is we look for ulcers, irritation, bleeding in any of these parts. It's not a painful process, a bit uncomfortable, so usually they give you something to numb your throat, and in some cases they give you something to sedate you, like keep you a bit, calm.
So is it done with you awake or with you honey hot?
You can be awake. We have endoscopies that are done with just numbing of the throat. If we suspect or we anticipate that will be taking longer, or we'll have to do some procedures, then we would like to put the patient to sleep completely. Yes.
So you can go to the throat,
Yes.
esophagus,
Yes.
awake,
Awake.
stomach, awake. Duodenum, awake.
Yes.
Hey, with that long thing in my mouth,
It's not
my
painful.
gag reflex will come.
Yes, so you find a lot of patients, retching,
Yeah,
trying to vomit, but then when you are a bit sedated, it keeps that feeling away. Yeah.
So that actually allows us to see what exactly is the
It
problem.
allows us to see what exactly is the problem. So if we see, for instance, an ulcer, then we would want to test for the most common cause, which is the Helicobacter pylori. We take a small sample, a snip of the lining of the stomach, and we test it. It's a non-spot test.
So we can do it like immediately.
Immediately. It takes about 3 minutes to read, 3 to 5 minutes. And then if you have the Helicobacter pylori, we give you some antibiotics over a course of 10 to 14 days to treat it. Yes. And after treatment, so what I must say is that most people, once you give them the antibiotics and the symptoms go away, they never come back. But you are supposed to come back for us to confirm whether the treatment actually worked. Because just like any other bacteria or pathogen, some strains of the Helicobacter pylori are actually resistant to some of the drugs we use. So if you don't come back for us to confirm eradication of this bacteria, you may have further infection. So that's when people claim that they have ulcer for life.
Okay.
But it's not something that you should be having, in a chronic form. Yes.
Ladies and gentlemen, we shall take our next break. Time flies. Our second song is Bigger by Prince Emmanuel.
Zed 101.
talking digestive disorders with Dr. Fatima Mohammed. Dr. Mohammed, assuming that anybody has these conditions and they leave it untreated, are there certain complications that can come?
Yes. So for peptic ulcer, I think I did mention a few of them. So you're at risk of bleeding from the ulcer.
Bleeding,
Yes.
anemia,
then
and all the
can
things
be
that come with it.
It can be life-threatening, actually. You can also, the ulcer can go as far as perforating or creating a hole in the stomach. Yes.
Ooh, so then
And then
the acid will now
leaks into your abdomen and then starts
That's a
digesting
horrible
some
thing.
other organs. Yes. So that's an emergency. And this is particularly true for those who have ulcer and they still binge drink. Yes, that can easily happen. And also for reflux, as I mentioned, you can have long-term irritation of the lining of the esophagus can lead to cancer. Peptic ulcers can also lead to cancers of the stomach as well. So that's why even when you are treated, we advise that you come back for us to check if the ulcer is completely healed. Don't just say I'm treated and that's it.
Do they sometimes need to have surgeries?
Yes, so when there's perforation, it's a surgical emergency. So it has to be fixed immediately. When there's bleeding, it depends on the level of bleeding. Some of the bleeds can be tackled by the same procedure I mentioned, by endoscopy. Other bleeds that are more serious have to undergo surgical interventions.
Wow. Are there particular foods and drinks that you should avoid if you have reflux or peptic ulcer?
Yes, so I mentioned that carbonated drinks are really bad for reflux per se, because
the gas will reflux.
The gas, causes, opening of that valve mechanism, and then it causes worsening of the acid reflux. Also, oily foods stay longer in the stomach, and then so it causes
more acid production.
More acid reflux. And some people find tomato-based foods to worsen their
but
reflux.
That's almost every Ghanaian dish.
Yes, so the Ghanaian
every Ghanaian dish is tomato stew.
some people find that when they travel out, their symptoms are less. When they travel out and they have to eat the bland food, the symptoms are less.
Only if you are not in Italy.
Yes. So those are the few things. And case by case basis, some people notice that some foods actually worsen their reflux. For peptic ulcer, I'd say that again, that it's not a chronic disease, and the ulcer can be treated and it can heal completely. So if you have ulcer, or you think you have ulcer over a long period of time, or you're experiencing dyspeptic symptoms like nausea, vomiting, pain in the region of the stomach, you should seek treatment and have it over and done with. For the H. pylori, I mentioned that one way we test for it is to take a little bit of the stomach lining during the endoscopy. Let me not deter the listeners. It doesn't mean that if you have any symptoms of ulcer, you definitely have an endoscopy. No. We do endoscopies for specific groups of people. I mentioned those who have what we call the alarm symptoms, and for those that we have treated for a number of times and they still have symptoms, that's when we do it. But if you come and you have symptoms of ulcer, we can also test for this H. pylori in your stool. Yes, so we can do the stool antigen, and if it's positive, we treat you without having to do an endoscopy. No.
So it's either from your stomach,
yes,
or from your stool.
Yes. We also have a blood test, but the blood test, I would say, is just to monitor, because it doesn't indicate whether you've had the infection in the past or you currently have it.
Yeah.
Yes. And if you do test positive for H. pylori, and other members of your family have symptoms, then they also need to be tested and treated.
So then you bring all your family members to bring their stool.
Exactly.
They should all use chamber pots. And then bring small specimens for assessment.
Yes.
Oh Lord, oh Lord, oh Lord, oh Lord. Are there any traditional or herbal remedies that you know of that work?
Okay, so I'm issuing a disclaimer, because some of these things, we the scientists, we say that they haven't been scientifically proven, yes. But then there's general knowledge that some foods help to soothe the stomach and help relieve symptoms of reflux and peptic ulcer. However, they don't treat it. So ginger, for example, helps to soothe the stomach. Yes. Chamomile tea. Licorice also helps. Yeah, some people find lemon. It's counterintuitive, but lemon
But it supposedly makes your whatever it is alkaline, and it's like, how does it? I still don't get that one.
So it stimulates, because it's acidic, so it stimulates the production of salivary.
Because it is acidic,
yes.
When you take it, it stimulates the production of.
So your saliva contains alkaline solution. Okay. So whenever you are hungry or there's acid in your stomach, you realize that you start salivating. And that's a natural mechanism to neutralize the stomach acid. It's the same mechanism by which some people find chewing gum in between meals to help relieve their symptoms, because chewing gum stimulates more, production of saliva. And
But it also makes you swallow air.
Yes.
And so then it makes you get more bloating.
Well, some people find that it helps with their reflux symptoms because swallowing the saliva with the alkaline solution kind of suits their reflux. Antacids have also been used to manage reflux, but they don't actually tackle the problem of the acid irritation, and you absolutely will need a PPI if you have irritation of your esophageal lining to heal it.
Oh, there's one more thing. It escaped me just now. That has to do. He didn't mention. I said, okay, you told me some traditional remedies. Milk. You didn't mention milk.
Yes,
Does milk work?
Yes, milk works temporarily. It works to just like taking an antacid, to neutralize the acid for a while. But as I mentioned, it doesn't tackle the real problem. So it's just the PPIs that have been studied to reduce.
And proven that they work.
Yes, there are new things on the blog. We have P-caps. They also work to reduce the acid production, in the stomach.
Dr. Mohammed, thank you very much for the insight that you've given us. I'd like us to close with this question. What simple steps can listeners take to protect and to maintain long-term digestive health?
Okay. So we say that your digestive system is the gateway to a healthy life. We've recently it's been studied that there's what we call the gut-brain axis. So what you eat actually influences your anxiety levels, how you cope with stress and all that. So it's important that we protect our gut health. Apart from the regular meals we eat, our staple Ghanaian foods, we can infuse a lot of fruits and vegetables into our meals, stay away from very refined or processed foods, and then cut down on sugar, cut down on oily or saturated fats. And then we can also incorporate other things like probiotics into our meals. Natural yogurt contains some probiotics, so it really does help to improve gut health. Yes.
Natural yogurt.
Yes.
Any other apart from yogurt?
So
for probiotics.
Yes. So apart from yogurt, we have some things called prebiotics. Inulin is one. Fortunately, we have inulin naturally occurring in our cassava.
So if you eat cassava?
Yes, cassava contains, inulin, and inulin it actually helps to grow the good bacteria in the gut.
So fufu is very healthy.
Fufu is healthy with the cassava.
I can't have it.
But then
from here, we're going to fufu.
Yes, but then let me come in. It also has a high glycemic index, meaning that it can raise your blood sugar. So eat in moderation.
Okay. How can you eat fufu in moderation?
So you can you can take more soup and then fish as opposed to all the meat swimming around the fufu. Yes.
Okay. So if we do that, we are covered.
Yes.
And we should avoid.
And then avoid alcohol, especially binge drinking, smoking. For those who are obese, exercise and diets to lose weight. And then also always check go for your annual checks. We call something called the fecal occult blood for those above 45 or 50 years. That is useful to detect early colon cancer. So go for your annual checks and then eat healthy and exercise.
Dr. Fatima Mohammed, thank you very much. It's been a pleasure having you, and we are grateful for the insight that you've given to us on this subject. From now on, we shall be more careful in the way we treat our digestive tract, so that we don't need to come and see you with problems. We only come and see you for checkups. We are grateful for your time.
Thank you for having me. Thank you.
Our pleasure. Anytime. Thank you very much. Ladies and gentlemen, this has been a great program. We'll see you again next week with a new and lovely topic. We shall exit with Big God by Tim Godfrey and the Fearless Community. Thank you very much. See you next week. Bye.
You're tuned